Mindfulness is a skill that we can get better at, and it can help with things like anxiety and tolerating uncertainty, helping us lean into things that are going to add meaning to our lives rather than kind of turning away out of fear.
You are a psychologist specializing in mindfulness and health psychology, which is a new term for me, but it's really like holistic is all included in that term. Can you expand on it? Health psychology.
Yes. That is part of what I love so much about health psychology is the holistic whole person approach. So health psychology really looks at all of the parts of our being that are impacting us. Social factors, our beliefs, our emotions, our behaviors. How are all of these things impacting our physical health? How can we optimize our emotional and mental states to improve our health? And how does our physical health improve our emotional and mental states? So as we know, it's all connected. There's the mind-body connection, which is an important part of health psychology and something I know we both appreciate.
Mm-hmm. Yeah, because they're all intertwined, and how we think affects how we feel, and how we feel affects how we make choices during the day, right? If we feel crappy, we're going to eat crappy, or we're going to affect other people with our crappy mood, right?
Yeah, what we say matters. It matters to how we feel. It matters to the choices that we make, the choices that we don't make, you know, leaning into things, avoiding things, just as you're saying.
Yeah, well, one of the things, maybe the most notable thing that I think of when I'm around you is consciousness. Something about your energy helps to slow my energy down so that I'm more conscious. I'm more in the present moment. I'm more mindful. Right?
Thank you.
And it's not like you're ever saying, Danica, you got to be more mindful. You're just being you. And then my reaction to it is more calm.
Oh, thank you.
No, I mean that. Like, it's really effortless to be around you, and it probably does something beneficial to my nervous system.
What a compliment. Thank you. We've definitely had a special connection and relationship from the beginning.
Yeah. When we first met, it was actually through Zoom. I thought our brands were aligned, Seed Fertility and Grow True Psychology, both implying potential when you are true to yourself and when you do some deeper work on yourself, right? So what was the message of Grow True for you?
Grow True started from the intention of building our self-awareness and creating that connection with our inner wisdom to relate to ourselves in a kind and compassionate way, and to understand ourselves and our needs and our values and our wants, and to be courageous to move in the direction of seeking those things, of developing the skills, of making the changes, of forming the relationships, of trying new things that help us feel like our most authentic selves, our self who is aligned with what matters to us, with the qualities that embody who we want to be and how we want to show up.
More integrated, right? Growing into a whole person would imply figuring out where we're leaking energy, where we are separated through traumas and different things. What kind of conditions do you typically work with in your clients?
So I take a health psychology approach. So the whole person, considering all of these parts of our lives. And I use an integration of different evidence-based psychological practices to help people with anxiety disorders, mood disorders, depression, life adjustment, changes that are happening as we transition, and comorbid medical illnesses. So when people are diagnosed with a cancer diagnosis, helping them cope with that, manage the stress, engage in a quality of life. things like chronic pain, chronic illnesses. So there's a wide spectrum. I would say that my majority of my focus is anxiety disorders, adjustment, relationships, and comorbid medical disorders.
Mm-hmm. Right. It's a perfect segue into fertility treatments because there's heartache, pain. Heartache is physical, or it has a physical component to it, right? When women want to become mothers, they actually feel a heart aching. They may have physical issues going on like endometriosis. They definitely have anxiety. They cannot be in the present moment because there's so much uncertainty for them. So they're worrying about a past cycle that didn't work or something that they should have known, or they're worrying about the future and what might not ever happen for them. So the anxiety of that for this patient population is really high. And then there's the medical condition itself and having, if, for example, unexplained infertility, they have that heightened anxiety, emotional reaction to feeling like their doctor isn't going to be able to figure out their case. So promoting mindfulness in these cases is super important because for them to feel like they're more in control, or they're in control of something, be it like, okay, what's my best choice just right now, right? What are a couple of suggestions that you might offer to somebody who's just so dysregulated by being labeled infertile?
With a mindfulness practice to help with those types of things, generally, I think one of the most important things is to practice. Mindfulness is a skill that we can get better at, and it can help with things like anxiety and tolerating uncertainty and helping us lean into things that are going to add meaning to our lives rather than kind of turning away out of fear. But it takes practice. It's so often people may have tried a formal mindfulness practice and I can't do it. My mind wanders and that's it. But that's typical. Our minds are made to wander, It's not something to fear or be frustrated by. So I think those would be my initial tips, kind of set the expectation that this isn't meant to be a perfect experience, that you're supposed to have a completely silent mind while you sit on a cushion. Expect that your mind's going to wander and offer yourself understanding and kindness from that. Practice, come back again and again. That is the practice, is to open to what is in this moment right now and to simply return over and over and over. And there's something really peaceful about being in the now, even when it's uncertain and fear and life and everything's happening around. There's something calming when we can anchor ourselves in the now and then choose from that place of greater calm, which direction do I want to move from here? How do I want to take just the next step? And to take those steps in a way that are aligned with, what matters to us and things that we value rather than out of habit or fear.
Or forcing something, right? Like thinking that if we pressurize other people or the process of trying by like scheduling it and then getting really upset by the results, it's an indirect form of pressuring. But I'm kind of speaking to more of this allowing, an allowing of an unfolding process to happen is a passive kind of power, right? And it's got at its root mindfulness, like to say, what is my best choice right now? To fly up into upregulation or to stay centered in just right this moment, I can at least remember to take a deep breath. I
Mm-hmm.
can put my feet on the ground. I can slow down my breathing. I can call somebody that I trust. I can play a meditation,
Mm-hmm.
right? These kinds of things. But the root question is, what's my best choice right now? And then an affirmation of, I allow necessary shifts to occur that are in the highest good of everyone involved and as quickly as possible. Meaning, like, this is really uncomfortable, but I am going to allow it to shift instead of thinking that I have to make something happen.
I think such an important word that you use there is choice. And that is part of the power of mindfulness, is that when mindfulness encourages us to pause so that we have the power of that choice. And we can choose to do any of those things that you mentioned. And so there can be action in that, choose stillness can also be an action. And there can also be an awareness of how that forcing is impacting us. We hold anxiety, we might notice it in our heads first, because thoughts are racing and we're feeling pulled to worry or ruminating about the past and, what if, and did I do this? But we hold a lot of tension in our bodies. And, when we pause to tune into that, we can feel constriction, closed off, we're closed from within with tension. And we can help ourselves in that way too,
To be self-aware, to be like, oh, I'm clenching my jaw. I didn't even realize that.
Mm-hmm.
Or, wow, I realized I haven't taken a deep breath all day,
Mm-hmm.
or I haven't emptied my bladder, or whatever, like those kinds of things that we just don't pay attention to until we start practicing to be attentive to them.
Yes. We can get pretty used to being quite tense.
Yeah, that's so funny, right? How many of your clients are saying that they're not really stressed out, but they are so stressed out. We've just all become used to being upregulated that it feels normal now.
Uh-huh. Yeah, I think sometimes, we can get we're so in the routine that it can be even hard to decipher something as, this is impacting me. This is stressful. This way of thinking is influencing my relationships, my relationship with myself. Being able to disentangle those things is an important power of mindfulness, I think.
Mm-hmm. For sure. Yeah. How would you give a suggestion, maybe just for just a starting point? How do we disentangle ourselves if we start to notice, oh my gosh, I've become so upregulated. I've like maybe they're having a panic attack. Let's use that as an example, because I do see that in my fertility practice where they let's say they're using Lupron, which is a ovarian suppression medication, so that they can calm and quiesce and then maybe synchronize their follicles, or maybe they need to calm and quiesce the uterine cavity before filling it with blood again in response to estrogen, because they're going to implant an embryo and they've had nothing but loss and failures beforehand. So when they use Lupron and that down regulation of the ovarian function, then it triggers this sense of helplessness and of remembering the trauma from before.
Mm-hmm.
So I'm your client right now. What would you tell me to do? I'm really upset and I'm really nervous because I'm so afraid it's not going to work. And this medication makes me feel like a headache and so anxious. My heart is racing all the time.
Mm-hmm. So I will say that with mindfulness and trauma, mindfulness is applicable to so many disorders and concerns. Trauma is something that we want to be particularly aware of with mindfulness, because there might be different challenges and difficulties. And so if there is a traumatic background, a history of trauma, it can be helpful to work with a professional. So, or to just think about differences to a practice. Perhaps you might not want to practice as long, or to keep your eyes open, to have that greater sense of safety. So I want to just, because you use the word trauma, I want to add that about mindfulness.
Well, there is such a thing as fertility PTSD, specific to these fertility cycles. And it's based on repeated disappointment and actual losses. And just the situation is so uncertain, and they have invested so much time, money. The relationship may not be going well as a result, and their self-esteem has taken one hit after another. So it does trigger such a high anxiety response that I would put it into fertility PTSD.
That makes sense. So I'll say, if we were sitting together in a moment like that, and we're kind of taking an entry point, to mindfulness, I think just a general practice that can be helpful is pausing. We're simply pausing and opening with curiosity to what is happening in my reality right now. Observing, what is the mind saying with thoughts? What am I feeling? Am I feeling sensations in the body? Very likely. Allowing these things to be, not trying to change them, to force them to be something different. The openness, the curiosity is the aim. And you don't have to do it for long, especially if it is a particularly upregulated situation. You don't want to overwhelm or make it worse.
By trying. Yeah. Because they already feel like they have failed themselves on some level. And so to feel like I can't relax, then that makes them even more anxious. And I'm sorry to interrupt you, but it's like there's also this perceived idea that if they get too stressed out, then they're going to cause more damage.
Yes. And so we want to take away that expectation, right? The expectation is not to make this go away or to solve it. That's not the purpose. The purpose in that moment is to open to what is, to rather than be restrictive, to allow some expansiveness within the mind and body. And to, in a more activated situation, to ground, to put your feet flat on the ground, to call upon some other things that are present in that moment. What am I seeing? What am I hearing? What am I feeling on my skin? Using the 5 senses to be mindful about the present moment.
What is that practice called? I know it's mindfulness, but is there a name for I know it as like color object or something. So like to bring a person into the moment, you tell them to just name things around the room and what color they are. So it would be like orange chair or pink wall, something like that. Do you know what I'm talking about?
I think there's a lot of different ways that you can do this. I often hear it as 5, 4, 3, 2, 1 exercise. So it's 5 things that you see, 4 things that you hear. You use your 5 senses. And I think the last one is taste, because usually we have like 1-ish taste in our mouth.
Okay.
But it's orientating yourself to what's going on around you right now, rather than feeling pulled into the future or the past.
Here's kind of a funny story. I had a failed VBAC attempt with my second pregnancy that led to an emergency C-section. And soon after that birth experience, I had to have some dental work done, and he put too much adrenaline into my numbing agent, and I went into a full panic, and I went back and relived that experience of being made unconscious to deliver my son. And I didn't see that coming, but it definitely happened. And I was like really freaking out in the dentist chair. And he tried to do what you just explained to do, but it was so harsh. It was just like, that's not happening right now. You're not in the C-section right now. You're in the dentist chair, like pressuring me, snap out of it already, but how can we soothe the edges? Right? I was just like, okay, because of my own training, I know what you're trying to do, and I will work with myself here to calm down, but you should not have given me that much adrenaline. But I mean, isn't that the nature of trauma? Stuff happens that's beyond our control, right?
Yes. So much is beyond our control.
Mm-hmm.
Yeah. But I think that you say soften the edges. And I think that is such self-compassion is what I just feel overwhelmed by in my mind, to soften the edges. Whether it's someone else who's feeling more harsh towards us, sometimes that is the case. Sometimes, and maybe more often, it's that we are being harsh with ourselves. That we are, maybe even if it's not as strong as a criticism or a judgment, the tone of how we talk to ourselves or the language, it can be blamey or kind of shaming ourselves.
I think shoulding on ourselves a lot is the thing. I should have started sooner, or I should have changed doctors, or gosh, I'm just thinking about in the fertility conversation, I should have done things differently, meaning a lot of regret.
Shoulds are the worst. It is. It's like shoulding on yourself. We didn't come up with that. Someone else did, but the name is eluding me right now. But it doesn't feel nice when we should on ourselves or when we should on others, And so language matters, what we're saying to ourselves makes a difference. And
you're sort of saying like the importance of reframing, right? Catching yourself. If you notice that you're being harsh on yourself, like, oh gosh, I should have done this differently. That's really a setup for a reframe to be like, wow, I'm curious how this is going to reveal itself later as the better way for this to unfold, because right now it looks really illogical to have had this loss. How am I supposed to explain that to myself if as the way it should have happened, or a reframe on that? But the reality is that a lot of times out into the future, when the situation is resolved, it is at a better time. So like that's one of many possibilities that happens. And I think the idea of being overwhelmed in the present moment is with all of the different possibilities and the things and the paths to take and the options.
Reframing, certainly. And we can also develop skills in being compassionate with ourselves along the way. Even when something doesn't obviously need to be reframed, we can become more skilled at talking kindly to ourselves, offering ourselves understanding and grace as we go through day-to-day life and are faced with inevitable failures and challenges and feelings of inadequacy. And so using all of that together, reframing when we need to, challenging those unhelpful thoughts, and also fostering that warm relationship with ourselves.
Challenging the negative thoughts, that is very powerful. And I think I do that a lot during the day. If there's a quick assumption or something, then I check in with myself and say, really? Is that really what you believe?
Mm-hmm.
And I know that was true on my path to pregnancy.
Mm-hmm.
I was crying. I was so upset. And I had been working on my fertility for 5 years. And then I'd get another diagnosis. Oh, great. My fallopian tube is blocked on the right.
Mm-hmm.
Or another breakup would happen. And I would just be thinking, it's never going to happen for me. And my former colleague said, is that what you really believe?
Mm-hmm.
Challenging that negative thought.
Mm-hmm.
And I was like, actually, no, I don't really believe
Mm-hmm.
that it's not going to happen for me. I just don't have the details of when and how and with who.
Mm-hmm. Mm-hmm.
Right? Isn't that a empowering reframe to challenge that?
Yes.
It's such a great idea.
Our minds are so tricky because, we have thoughts constantly all day long, and we're often inclined to believe that all of those thoughts are true. And
oh no.
And they're just not.
Right.
Some of them are certainly true or half true, but some of them aren't at all, you know?
Mm-hmm.
And so mindfulness helps with that, because if we're going to reframe a thought or challenge it, we have to first be aware that we're having that thought, and sometimes we become so swept away in our thoughts that it can be hard to kind of pin them down. And if we can't pin them down or identify them, then we don't really know what we're working with or how we're trying to change them or accept them.
Yeah. Right. Well, I'm thinking of how heady or analytical a lot of us are, right? And if we normally think 50,000 thoughts per day, or there's 50,000 plus thoughts that are processed each day, the more analytical that we are and the more up in our head we are, if we can master this idea of reframing or mindfulness, then we can bombard our field or around us, our energy field, 50,000 times per day with, it is going to happen for me. I can trust life to work out in a way that's going to make me happy. I can reframe this. There are many things I can do. Everything is okay right now. Those kinds of thoughts that are very calming, and to repeatedly send them inward, I think, and it's true for me, I've watched it with my patients, that is the beginning of a redirect. Right now we're talking about neuroplasticity, where that groove in the brain that's gone to, woe is me, it's not fair, I'm a victim of my fertility, but one rogue neuron that jumps over that says, wait a minute, I'm challenging that belief. Wait a minute, maybe it can work, or maybe there's something I haven't thought of yet, or there's something I haven't tried, or something I need to be open to, or I allow a shift to occur, right?
It's hope.
Oh, to start hope?
Yeah, well, how you're describing this, I mean, it feels hopeful, right? And that's what you're describing. That's a power from within that you're giving yourself by being intentional about how you are thinking, how you're talking to yourself, how you're evaluating things around you, how you're perceiving things. And these are also skills, adaptive perspective taking, challenging and working through beliefs that are no longer helpful or serving us. And it's a practice,
And I think it starts with some kind of visual, right? Or somebody says something and you think like, oh, wait a second. This idea of that rogue thought form jumping into this other direction to start creating a different groove that we could even imagine routes over into a more fertile version of myself, right? Visuals are powerful tools.
I think so. Visualization is certainly a wonderful tool to have in your toolbox, I think. Whether visualizing peaceful scenes or the rogue neuron or whatever it is, the face of someone you love when you're stressed, I think that there's a wide range of how that could be used. And I I do like visualization personally. I'm a visual learner. So I like to, like we've talked about the fertile garden.
Yeah,
And I
exactly.
love that image.
And the image of pulling emotional weeds, things that haven't been processed, things that are scary, things that are literally tripping us up, doing reconciliation, amends work, that kind of thing. And then putting in more nutrients, more love, better conditions.
Yeah. Planting seeds for growth and for change and the, what you want to see in your life blossom.
Yeah. Well, because you work here at Well People, you're obviously familiar with the seed fertility program.
Yes.
And, I have it kind of broken into two big concepts, fertile thoughts and fertile foods, and how both of those are used around the 28-day cycle to kind of mimic a normal hormone dance, right? So in that week where the period has happened and the estrogen is low, there's crying and a good opportunity for cleansing and releasing. And then they naturally go into the pre-ovulatory week where the estrogen starts building up and they start to feel more confident in the outcome, in their body. They feel more relaxed around things because they have the estrogen, which is, right, the calming yin hormone. And then after the action of a ruptured egg ovulation or egg retrieval, they go into that phase 3, which is the post-ovulatory or post-embryo transfer era of being very vulnerable. And that's an innate hormone dance with estrogen and progesterone. And it's like, we don't know if fertilization has occurred. We don't know if implantation has occurred. So it's an insecure moment. And then there's the premenstrual window where they're very aware, success or failure. And even if they're not trying to conceive, it's like, do I feel like I'm succeeding at life or failing miserably or somewhere in between? So this idea of these fertile thoughts that mimic a woman's cycle, what is your thought as a psychologist of something like that, where there's this framework that psychology can fit into, where it changes and becomes a little bit predictive? And by predictive, I mean that women are kind of teased for being crazy, right, and unpredictable and whatnot. But fertile thoughts means that if they understand their cycle and how their energy is going to change, how their emotional response is going to change based on their hormones, they become very predictable. So I'm just thinking in the context of mindfulness, do you see the way that predicting a hard time and having a practice of mindfulness could work together?
So sometimes the way that our minds are less helpful is when we jump to conclusions about something or make assumptions. And, we can think in that way, predicting something that hasn't happened, kind of assuming that we know what will happen. And we can experience that. We can have emotional reactions to that. It can impact our behavior, what we choose to do or not to do, how we cope with the stress. And so mindfulness, by the nature of the practice, bringing us back to the present moment and aiming to open to what is right now without judgment, letting go of the jumping to conclusions or the assumptions, that changes the whole landscape and trajectory. There isn't predicting that's happening.
Okay, because it's just like take it 1 minute at a time. It's kind of what you're saying.
Yeah.
That if you really get anchored in mindfulness, then it doesn't really matter what cycle day you're on because you are really just having that experience in that day.
Yes.
Uh-huh.
Of course, as human beings, we plan and, we,
especially female human beings.
Yeah, so we can't just like completely live in one moment at a time, of course. But there, with things like this, when we are, it's such high stakes and we're predicting and we feel so attached to an outcome. And yet there's a lot that we don't have control over. So there's, there's little predicting that can be done, Then yes, coming back to mindfulness is the practice of what can I do now? I can be here now. I can support myself in these moments. I can make choices, based on this information that I have at this point. And as this process, this journey continues to unfold, I can do the best that I can for myself and for the people around me and support myself by aligning with the values that put me on the path to where I hope to go.
Mm-hmm. Yeah. I think this particular patient population, with the anxiety that they feel when they are in the SEED program, and it says, you might be feeling the craving for a quesadilla today. They are so happy to see something like that. If they were having a craving for pizza or quesadilla, they love seeing where they are normal.
It's validating. I get that. It's validating.
Yeah.
Yeah.
And then it's really like, oh, I'm doing something right. I'm in the present moment. I am really on cycle day 13 right now. Something like that.
And that's wonderful, I think, to have that reinforcement that can foster a sense of trust in yourself.
For sure. On this journey, yes.
Yeah, like I am in tune with what's happening with my body. I can, we are working together, and
yay.
Yeah, I think even if we can't predict the future and there's lots that we can't control, to have those pieces of encouragement, I think that's really valuable.
100%. It's like this process for patients to learn how to meditate or to become more mindful. It's one of the, quote, benefits of a fertility journey, that maybe they wouldn't find themselves seeking if they weren't forced to, right?
Perhaps.
And it's kind of a wonderful thing to develop a meditation practice, or even just to be streaming some kind of meditative streaming a meditation or some kind of consciousness building. But I do see that as something that we're all evolving to do more and to kind of poo-poo less.
Yeah, I think it's a wonderful thing.
Yeah. I mean, we're different generations. So, when I was meditating so much, I was like your age, and I was cultivating a meditative practice. And then I was using that information to help my patients, and they perceive me as so calm. But it's something that everybody can try and maybe benefit from. And especially as the world gets louder and the perception is that it's more apocalyptic and it's scary, and all the different things that are coming up that we think we need to worry about, to know that we can anchor in ourselves and like shut our eyes, turn off the phone, even just for a few minutes. I was meditating for like 2 hours a day, but I was doing it. I had toddlers. I mean, I've been meditating for a couple of decades, but when I had the kids, that was when I was really writing the SEED program to make it into a website. And I was editing my book. So I was doing all that stuff in the middle of the night because it was the only time when it was quiet. So I'd put my kids to bed. I'd lay down there with them. And then I would sleep for a few hours and I would get up around like 3 a.m. and I would sit in meditation for 2 hours. I wasn't sleeping. I was just sitting. I didn't need music or anything. And I would sit there and I would feel this like pulsing golden orb of light. And I could feel it infusing my body with some kind of healing essence or energy. And it was like, wow, I don't really want to come out of this. It's like being in a massage and you don't want it to end. That's how meditation had become for me. Like it was maybe like an escape from the harshness of my life. But really what it did is it gave back so much energy that then I was able to write those edits and write like so much that needed to be done, that needed to come through me. And then maybe I'd lay back down to go to sleep, but generally speaking, and then I would just be like mindfully coming out and get things going. I have like a cup of coffee or something like 5:30 or 6, and then get the kids up for whatever. They'd wake up early. And then I wasn't feeling as exhausted as you would think with that little sleep, because it's like a whole other way of being in a body, you know? And I don't know the science of meditation. Maybe you do, to get some idea of what it does to the body, the physiology, to access some of those gamma brain waves and the supporting neuropeptides and things. Do you have anything to add to that?
I think what can be so powerful about a meditation practice is that present moment, being in the present and not expending the energy to be in the future or the past. Kind of like that energy leak, you know, so much energy can go in these different directions. And when we are practicing formally with meditation or practicing mindfulness, and to regather our resources and to connect with ourselves in a simpler way in some sense. And, you know, what you were saying earlier, I agree that, you know, mindfulness, humans have access to this. Humans have access to mindfulness, and it can be a formal practice on a cushion for any amount of time. And it can also be something that we practice throughout any day, you know,
like in the shower,
definitely
while driving.
Yeah. In the, you know, pausing at the top of the hour, every time you get an email, when you're brushing your teeth, but when you're eating, you know, anything, because we're just coming back to the present moment. And so I think that's also important when we're thinking about using it to help ourselves, that it doesn't need to be something else to put into the day, you know, another thing to do on the list that we need a lot of time for. We can incorporate it in a way to support us and build that practice, but the practice is important.
Yeah, I can imagine fertility patients listening and thinking, oh my God, 2 hours? I have to sit still for 2 hours? How in the world? So thank you for saying that, how it can just kind of slip in there while you're eating, while you're showering, while you're driving, that consciousness of, oh, I'm sitting here. My heart is beating without any effort of mine, right? The lungs are extracting oxygen without any effort from me. That's something my meditation teacher says in a recording. Anyway, something to keep in mind. Well, Sam, anything else that you'd like to add about health psychology, maybe in the lens of how you think it could be helpful for women and couples going through fertility and struggling?
Yeah, I think for fertility issues, health psychology is a wonderful approach, or can be a wonderful approach, because there are so many of those factors that we talked about going on. You know, there are medical implications, perhaps medical conditions, there are the social aspects, the psychological aspects. And so really approaching that journey that an individual or couple is going through from that whole person approach, and working with perhaps a multidisciplinary team, to best support that person in addressing the medical components, the biological components, and the psychological intervention, and modifying lifestyle to be supportive to that journey. That's an important area of health psychology, is, promoting healthy behaviors to help people optimize their wellness and health. And so, of course, it's sleep, nutrition, exercise, and it's also stress management and having positive social interactions. So, yeah, I think there's potentially a lot of opportunity for that, and it could be a good fit.
Mm-hmm. I can imagine if I was back there going through fertility and all the different pieces of information that I was grappling with as a woman at age 31 who was told that I was going into early menopause. And then I learned my fallopian tube was blocked and I had severe endometriosis and no partner. It would have felt so good to sit across from you, and to learn how to calm myself down with those pieces of information.
I would have liked that.
Yeah.
In another life, if that had been our relationship. But I'm very glad for the relationship that we have now.
Yeah. Well, you have brought such calm to my afternoon. Thank you so much. And thank you for sharing some of the tools that women can use, or listeners. Where can they find you?
Yes. So you can find me at my on my website, drsamanthamunson.com, and email, phone, all of the contact information's there, and Dr. Samantha Munson on Instagram. And those are the best ways.
Perfect. Okay.
And of course, you're at Well People.
Yes, exactly. All right. Well, thank you so much.
Thank you.